Welcome back to Coffee Talk with Mike and Janelle. We're on episode 23. We'd like to continue our discussion. We started last episode about finding an appropriate provider for you, and we'd like to focus a little bit more on what it means to be prepared for your initial visit. We know that these visits with doctors are very time limited, so we really need to be efficient. Mike?
Yeah, a lot of people, you're awfully lucky if you get an appointment in a very short time span, particularly with a child psychiatrist, particularly if it's someone who is specializing in autism or intellectual developmental disabilities. So this is kind of like a checklist guide of things from a practitioner's standpoint of how to best be prepared so you can get the most out of that time. And so from a 10,000 foot level, just logistically, certain things to kind of think about and be aware of. What is the average length of the appointment? A lot of places, I know when I was in more private practice, I'd have an hour initial assessment and typically a 30-minute follow-up within 2 or 3 weeks. And that was kind of my initial thing. Weren't going to be done with everything by then, but that's how much time it took me to get some base stuff. But based on where you are in different places, initial appointments may be 30 minutes. Sadly, they may be 20 minutes. So having an expectation so that you can best budget your time for that. We talked about this a little bit before, but I think it's important enough to it bears repeating. You can ask what the average wait is. So if your appointment's at 11, but the doctor's always like an hour behind. Some doctors will be militant and be out behind. Then maybe you can negotiate something. You don't want to miss your appointment. You certainly don't want to be late for your appointment. But it's possible. Can I check in and set up the car if that's going to help my child a little bit better and come up right at the end. And then also, I don't know if anyone's gone and established a new doctor or dentist appointment. You show up and there's like 45 minutes worth of paperwork to do. If there is going to be paperwork, how much of that can be done ahead of time, particularly if your child or loved one is someone who's going to struggle in a waiting room
while you're completing
all absolutely. So those are just kind of like at the very beginning things to consider. I know, Janelle, you have a laundry list of things to consider, and each and every one of these points is super important. So I'll hand it over to you.
Yes, I do. So I'm just thinking from a practical standpoint, when we meet with folks for the first time, what's important for us. You should be early. Your appointment's going to be very time limited again. So if you're early, maybe you'll get in early, maybe you won't, but you're certainly not going to be late and cutting into, that time that you have with the provider. Bring your insurance card, your ID, bring your list of medications and dosages that you take. Make sure you include all your vitamins and supplements because some of those do have interactions.
Absolutely.
You should be honest about any substances that you use. Some people may, use alcohol or benzodiazepines or other substances to help them calm.
And particularly during pregnancy, so this is a time that we can't be embarrassed, right? I mean, we want to let the provider know as much information.
Yes.
Even if it's
for interactions and other outcomes. Absolutely. Bring a list of questions and concerns that you have, things that you're really worried about, and prioritize them so you make sure that the most important things are attended to up front. And if you don't get to the last things, then you can, save them for the next appointment. Sometimes it helps when you bring somebody with you. There are a second set of ears and eyes to kind of absorb all of the information.
And if you don't mind, that also can be helpful because sometimes, like in a child psych appointment, we very often will want to speak to the parents separately. Or we may need someone who can take the child if they're getting really disinhibited out of the room so we can continue the appointment. So having that backup can be really helpful.
Absolutely, that's a good point. Any testing or evaluations that you feel is important for the new doctor to review. You're going to have to be able to complete, like you said, maybe beforehand, any medical history that's pertinent. Your family history is very important as well, especially for psychiatry. A list of any of the allergies you may have, a list of providers that you currently see, their contact information. While you're at the appointment, you may be sent out to a specialist. Make sure that you have the information for those referrals, the contacts, so when you leave there, you know who to contact and when. Documenting your next appointment with the provider. If you have questions or there's information's presented, things that you want to research further, make sure you document that so when you leave you have that and you can look into things later. Most importantly, I think if you don't have a good fit with your provider, you're not going to be able to be open and honest and communicate all of your needs, your concerns, your wants. So you're here evaluating them as much as they're evaluating you. So I would just say make sure that it's a good fit.
Yeah, yeah, and sometimes we don't have the luxury of that because there may only be a couple
Limited
opportunities.
providers, yeah.
But you know, I guess the point of this video is really how can we maximize that doctor-patient family relationship, you know, and have the best fit possible. So a couple things, I know I chimed in a couple times during Janell's list. The med list. The med list is hugely important to
Yes.
us. And some folks that have come to us have been on so many meds and so many complicated regimens. One of the little hints that we give families is if you've been going to the same pharmacy, you go to Rite Aid, you go to CVS, you go to Walgreens, if you go to the pharmacy and just ask them to print out a list of every prescription your child has had. It may be the size of a phone book. And this is really important stuff because then you can just hand it over and the doctor can take a look at that kind of on their own time. Another thing that families often bring, sometimes families come with very little information and everything that Janell said is super important. Sometimes they come with tons of information in a binder. Do not expect the provider to look through all of that, and certainly not during the time of the appointment. I've had families be insulted that I didn't want to go through everything in the first appointment. I said, no, I'll take a look at, or I may use it as a resource later on when I have other questions. But right now for me, I'm really trying to get to know you and your loved one. So you know, and we don't want to spend 40 minutes reviewing 300 pages and you know, eat up the entire appointment time. It's very often, I mean, we get it. We work with severely developmentally disabled individuals with significant self-interest behaviors and aggression. So we get it. We do not need a family to come in and convince us of the severity of their loved one's behaviors. But that's not true for everyone. And I think one of the things families will often do is bring in videos or other things so that they can show. Now that can be incredibly helpful, particularly with side effects with meds. Like, my child's doing this. What do you think this looks like? Stuff like that. Videos have their place. But overwhelming provider with hours of footage, it's just not practical, it's not reasonable, and so we want to utilize the time we have most. One of the things that I think about, and part of this is, Janell already said, we're looking for best fit.
Yeah.
Right? We're developing a relationship. That really should be the key of your first appointment. I know families have struggled. I know they're looking for help. I know they're looking for fixes, sometimes quick fixes that may not exist. But I also want them going in with unrealistic expectations. Goals of that first appointment: establish a relationship. Determine what long-term treatment goals are. Nothing is worse than if a family wants X, Y, and Z, and the doctor is thinking the treatment goals are 1, 2, and 3 over here.
Right.
Make sure that you are aligned as a team. These are the most important things to you. Let's prioritize the most important things first. Janell already said that, and then we'll work toward the secondary, tertiary things down the road. Do not expect to leave with a diagnosis. Do not expect to leave with a new medication or medication change in your first appointment. Those things may happen. Sometimes they're really self-evident and there's things to do right away. Sometimes they're not, and families often feel like, well, we came here and nothing happened. But again, if you go into it with the idea that you're trying to establish a long-term doctor-patient relationship, yes, we want to do things quickly. We don't want to put you guys off.
Right.
But we want this. And then I think it's super important to get a sense of two other things. What's the frequency of follow-up going to be? Is this a once a month? Is this a once every 3 months kind of thing? So that we can figure out what the timeline of treatment is. And two, what is the best way to communicate with that doctor in between appointments? If you're in a single office, you call, you get the nurse on the line, they give a message, doctor gets back to you that day, hopefully. But many psychiatrists work in multiple places, and many will only look at their messages when they're on site of that one location. So figuring out what the preference is, and it can go across the gambit. Many of my patients have my cell phone.
Yeah.
But that is not necessarily the norm. Like,
I was going to say, you're not going to get that treatment from every provider.
What is the right number to call? What kinds of things does the doctor want to know about versus what kinds of things can wait till the next appointment? It's all about establishing that relationship and those lines of communication so that, again, you can get the best fit and move forward with care.
I agree. I think communication is key, and I think it's important for everyone to be aware and acknowledge that, you know, treatment is going to be an evolving process, and each step is going to be predicated on the one before and the outcomes of that. But if you at least have clear goals that the family and the provider are both on the same page
And
with,
the individual
agreeable
who we're
with.
treating as well.
Yes.
Absolutely.
So those are things that I think are very important to keep in mind. It's an ongoing process. So
Absolutely. So hopefully this is helpful. Next episode, we're going to talk a little bit about what to be thinking about for follow-up appointments and ongoing treatment, and you know how to manage them best so that you know you can and your loved ones can live their best lives.
sounds great.
Okay.
Until next time.
APEC out.
APEC out.